Drowning is defined as death caused by asphyxia due to submersion in a liquid medium. Near drowning is survival after immediate respiratory impairment following submersion, often requiring urgent medical care. There are different types of drowning. Wet drowning is when water enters the lungs. Dry drowning occurs when the airway closes due to a reflex spasm. Secondary drowning is delayed respiratory failure caused by water in the lungs. For first aid management, call for help and check if the victim is responsive. Start rescue breathing if they are not breathing, giving 2 breaths for every 30 compressions. Begin CPR if there is no pulse, and continue until emergency personnel arrive. Diarrhea is the passage of 3 or more loose or watery stools per day. It can be acute or chronic and often resolves on its own. Causes of diarrhea include viral, bacterial, or parasitic infections. Dietary factors like food intolerances and medical conditions such as inflammatory bowel disease or malabsorption disorders can also be causes. Adverse consequences of diarrhea include dehydration due to the loss of fluids and electrolytes, electrolyte imbalance, and malnutrition from poor nutrient absorption if prolonged. Signs of mild dehydration include dry mouth, thirst, and headache. Severe signs involve sunken eyes, lethargy, and low blood pressure. The mechanism of vomiting is initiated by stimuli, activating the chemoreceptor trigger zone in the brain. The pre-ejection phase involves nausea and increased salivation. The retching phase involves stabilizing the chest with deep inspiration and breath holding, followed by muscle contractions. The ejection phase is the forceful expulsion of stomach contents. This requires complex nervous system coordination. Vomiting is commonly caused by gastroenteritis or food poisoning. Other causes include pregnancy, certain medications, and motion sickness. For emergency management of vomiting, position the person to prevent choking. Rehydrate with small sips of water or oral rehydration solution. Seek medical help if vomiting continues. First aid for diarrhea focuses on hydration to replace lost fluids and electrolytes using an oral rehydration solution. It is important to monitor for signs of dehydration. If someone is vomiting, encourage small sips of water or oral rehydration solution. Avoid solid foods until the vomiting stops and seek medical help for persistent vomiting. In conclusion, recognize symptoms early and act quickly. Hydration is crucial in managing diarrhea and vomiting. Timely intervention can potentially save lives.